Hello, good afternoon, everyone from the World Health Organization headquarters in Geneva. My name is Alexandra Kuzmanovic from the Department of Communications, and it's my great pleasure to have with us today our senior laboratory expert, Frank Konings, who will be here with us to respond all your questions on COVID-19 laboratory and testing work that's happening around the world. So please ask your questions on Facebook and LinkedIn via comment section, and on Twitter use hashtag AskWHO. Good afternoon, Frank. How are you?
I'm very fine. Thank you.
Thank you very much for taking time to speak to our social media viewers and respond their questions. You have very interesting experience in past months in various regions and some missions in countries. So would you please share some highlights, what you have seen in the field so far?
Sure, and thank you so much, Alexandra, again for inviting me to talk a little bit about laboratory in the context of COVID-19. I'm actually trained as a virologist, and for the last couple of years I've been working at the World Health Organization. Always worked on laboratories and diagnostics, and for the first couple of years I was in Asia. Currently I'm in the Middle East and also working now here at the headquarters. What I do is I work with countries to set up diagnostics and detection mechanisms for infectious diseases. These infectious diseases need to be monitored very carefully, and the diagnostics really need to be in place in order to get rapid, accurate and safe results. In order to do so, we're not doing this alone. We're also working with other institutions, and also we have our country offices and regional offices. So we're really looking at a combination of all of these factors. So it's not just the testing itself, but it's also looking at the whole system of laboratories, how it comes together. With regards to COVID-19, what I'm working on right now, here at HQ, but also when I was in the Middle East, we really try to help the countries to support them with establishing these diagnostic capacities so that they can test themselves for COVID-19. And it also gives us the opportunity to closely monitor the virus. So that's sort of in a nutshell what we've been doing. We've had some country missions. I went to Iraq and Bahrain, and currently now I'm working with my colleagues here in the team for diagnostics at the Health Emergencies Program.
Thank you, Frank. Thank you very much. Would you just give a bit of more information how these missions in Iraq and Bahrain went, and how your day would look like on a mission during COVID-19?
Right. Actually, they're very good missions. They're very early on in the outbreak of COVID-19. The regional office, MRO, put together a very diverse group of people and experts in different areas, like lab, I was responsible for that, but you also have infection prevention and control, surveillance, and so on. So during these missions, I went on site. I met with the senior government officials, visited also the Central Public Health Laboratory, and interestingly, at that time when we were in Iraq, we were working mostly in Baghdad. The center of the testing at that time was mainly at central level. And we had very good discussions also with the director of Central Public Health Laboratory and all the colleagues there to see how we can expand the testing, not only at central level, but also move it to the decentralized, to sort of the labs outside of the capital. So those are some of the things that we were working on.
Thank you, Frank. Very, very interesting and important as well to share what is the work we do in the field and to make impact in countries directly. So let's talk about testing now. There are different kinds of tests for COVID-19.
Yeah.
So would you explain to us what are the types of tests and what are the differences?
Very good question, and actually I get that question a lot. Generally speaking, there are two kinds of tests. So one test looks at the virus itself, and that is a sort of a molecular test. And this is the one where they first swab your nose or your throat and then do sort of a molecular assay on it to see if there's actual virus in your body. So it's an active infection, so you know the virus is there. Then the other type of test is what we call with a difficult word, serology test. So Serology is based on taking blood and looking at what type of molecules your virus has or your body has produced against the virus. So it looks back in time. So you can see if your body has produced a virus, anything against the virus in terms of antibodies. So these kind of tests are actually quite useful if you want to better understand the spread of the disease. How far has it gone? Even though the people we are tested don't have an active infection anymore. So those are the two main kinds of tests.
Thank you, Frank. So if you look at an individual level, so a person goes to a health facility and gets tested, like swab is taken, what happens between that moment until the person gets the results? What's the work behind the scenes in the testing and laboratory work?
Yeah, so now you are getting into the area where I'm very active myself. For the testing, usually exactly as you say it, you see the swab being taken and then it disappears behind the door and you don't see it anymore. So what happens is so they take a swab, say as example we do the molecular test, for the active infection. So they take a swab, they put that in a tube, and that tube has a little bit of a liquid to keep the virus moist, so to say. Then they screw it, put a screw on it and put it in a Ziploc bag. Then they add also the patient information, because you just don't want the test to go by itself. You need to have the patient information there as well. Another Ziploc bag, and then it's transferred to the lab. So the lab could be on site where the test is being taken, but could also be elsewhere. So once it arrives in the lab, a lab technician who's fully equipped to work safely with the specimens, like goggles, gown, and gloves. And then they take very carefully a particular volume out of that liquid that now has the virus in it. And what they do is they extract the genetic material of the virus. So once we have that genetic material of the virus, genetic material is basically what the recipe to make a virus. So it really describes all the letters that make up a virus. And then they put it in a particular machine to make more copies of that genetic material, because if you just have a little bit, you won't be able to see it. But if you make a lot of it, you're able to detect it. So once it goes through that test, a lot of these copies are being made, and at a certain point we are able to see it. There's a special chemical reaction that gives a bit of a light, and then we are able to pick it up how much is in that specimen. So that's how it works in terms of getting a positive result. There's no amplification if it's a negative result. That result then goes back to the healthcare provider and in turn to the patient.
Thank you very much, Frank. You mentioned there is a sample, they put it in a zip bag, and then if there is no laboratory on site, it needs to be sent somewhere where the laboratory is. Yeah. Is there a time limit for how long the sample is good to be tested, or it can last for longer?
Yeah. Very good question again, and there are actually too many elements to this particular transportation of the test. One is you need to maintain the quality of the specimen as it is being transferred to the laboratory, because if it's too warm, for example, the virus may degrade and you will not be able to detect it anymore. But what's really important is the turnaround time, because you want to get the test result as quickly as possible, because only then are you able to take the right public health measures. Public health actions, like for example, the patient needs to go into isolation, or you need to start contact tracing and these kind of things, like the people who are around this person who's now positive. So turnaround time is really very important, and we try to really increase it as much as possible.
Thank you, Frank. You mentioned
or decrease to make it as short as possible.
As short as possible. Understandable. You mentioned transportation, you mentioned labs, but we have a health worker taking the sample. So how many people are involved in this process, and who are those people behind the scenes that we don't see actually? Right. We have a picture of a health worker and they are on the front lines, but there is a chain of people, I would say, who are involved in this process.
No, you're absolutely right, and the people who are working in the labs are just the absolute heroes, if you ask me. They're doing such a tremendous job. Every time I've been on site and I see all the things that they are doing, working really very hard. So you have the people who do all the individual steps. Some people do all the steps by themselves, but others they divvy it up into different responsibilities. Aside from the people who are doing the work, we need to make sure that they don't, get exhausted. Because during situations like COVID, you may end up with a tremendous amount and number of specimens that need to be tested. And all these, you need to stay focused in order to do it safely and also get accurate results, make sure you don't get mixed up and those kind of things. So that's really key. Aside from the people who are doing the practical work in the laboratory, you also, of course, have the management and the leadership of the laboratory. And that's equally important, sometimes a little bit forgotten. The leadership very often are technical people who raise up the ranks and became lab leaders themselves, but don't always have the right management skills. So now, for example, WHO is also working with some of these programs to provide a leadership program. We call that the Global Laboratory Leadership Program, and we're currently working on that in Pakistan. So it's the different levels within the lab that are all involved.
Thank you very much, Frank, and we're already receiving a lot of questions from our viewers, and thank you, everyone. So I'll start first with one question from Katie Hawk. What is the accuracy of the lab test results? I read evidence that says 80% accuracy. Mm-hmm.
That's really a great question, Katie, and I'm really glad you're asking it. So accuracy of lab tests depends on what test you're talking about. Remember in the beginning I said you can do this molecular test and you can do this serology test. So the molecular test is much more accurate in general speaking than the serology. Accuracy is so important because if you, for example, the test is not so accurate and then it says you get a positive result, but in fact it's not a positive result. The person may actually end up in isolation, or you start contact tracing, which is not really necessary. And the opposite is also true. If you have a negative result that's actually positive, then that person can go freely around in the community and infect others. So accuracy is really, really very important, and I'm glad you raised it, Katie.
Thank you, Frank. How long does it take to get results from the moment a person is tested?
Yeah, as I said earlier, it really depends. We really try to optimize getting the results as quickly as possible so we can take that action. Ideally, you would think, within a day or even faster. Some devices can do it very quickly, so you can get the result while you're waiting, but those devices are not always available everywhere. If the specimen actually has to go outside of the place where it's being collected, it may go to an external lab. The transportation takes time. Maybe there's so many specimens, there's a backlog. Maybe there's a lack of reagents. Maybe there's not enough staff. So it can take a couple of days, but ideally we really shorten it as much as possible so that we get the result and take the necessary action to follow.
Thank you, Frank. Here comes the question from Usman Kariko Binava on LinkedIn. Is there possibility of inventing a simpler testing methodologies?
Simpler testing methodologies. Yes, actually, some of these newer tests are being developed. We sort of like what we say point of care tests, so that these are small devices that you can add your specimen to, and they will run similar to like with a little cartridge, similar like an inkjet printer. You have a cartridge, you have a machine, you add your specimen and it tests, so it's a little bit faster. There's several of these devices on the market, but we're still taking a closer look at how well they perform and how well they can be used in a field setting. And if, for example, the manufacturer can make enough of them to really help us. But I really like your question, Usman, about the new technologies, and I think there's a lot in the pipeline and many more coming.
Thank you very much, Frank. Here's the next question coming from Tasneem Aboud on Facebook. Is the test accurate in the first days when a person had contact with a positive patient, or should we wait for a few days then go to test? So when is the best time to go for, how do we know when we should go and ask for a test?
Right. Well, it all depends. If you go too early, if you're too early, then sometimes the test may actually become negative while you're still infected. And the same is also true if you're all the way at the end. Later on, sometimes it still lingers a little bit, even though you're not showing any symptoms anymore. So going to get tested, generally when you have symptoms, and also when you've, for example, been to places where you've traveled to places where COVID is circulating, or you've possibly been in contact with a friend or a colleague or somebody else who has COVID confirmed. Those kind of things you really need to take into account. When you do so, especially for those people who are living in places where other pathogens circulate or diseases circulate, like dengue and malaria, we always need to be aware that those can also cause fever and some of similar symptoms as well, or for example, flu.
Thank you, Frank. I'll pass another question coming from Twitter viewer, Sanela Sano Nkobo from South Africa, saying that they are having about 10,000 new COVID-19 cases a day. This is causing delays to getting results as some labs are overwhelmed. Is it still useful to screen the community at the peak of the epidemic?
Yeah, these kind of situations are really very complex and very difficult to manage. However, you really need to try to prioritize your testing strategy, as we say. So sometimes when there's so many of these cases coming all at the same time, you may want to consider testing, for example, vulnerable people first, or healthcare workers, or some of those first cases in closed settings like schools or prisons or those kind of places. So usually you really need to take into account the local situation and develop a testing strategy around it.
Thank you, Frank. So what are the biggest challenges to build laboratory capacities, and what we as WHO do to support countries to expand their capacities and test as many people as possible?
Yeah, another great question. And this is actually something that I've been working on for all the time that I've been at WHO. And I'm giving you first a general answer and then a COVID-specific answer. The general answer is we need more political commitment and more political support for laboratories at national level. There really needs to be more attention and also an allocated budget for laboratories so that we can really build those systems properly. For COVID, actually, the important thing is really something that we saw, really the international shortages of reagents. As I just explained, all the different steps that you need to do for doing the test, we weren't always able to get all these reagents to the right places and to the countries. So that was really a challenge. Some countries though, and I come back to Iraq again because that's a country I'm quite familiar with, they became quite creative and inventive and practical, which was really good. Like for example, I remember I mentioned that tube where you put in the swab to bring it to the lab. They couldn't find it anymore commercially, and they didn't know where to get it. And what they decided to do is actually to make it themselves. So they made the tubes with the liquid and the swabs and sterilized it and make it proper, and they were able to distribute that across the country. So sometimes these kind of creative solutions are really quite useful.
Thank you very much, Frank. Here's another question coming from Jessie on LinkedIn. She says, with little information about immunity on COVID-19, what is the value of antibody tests?
It's a very good question. I say that a lot, but all your questions are really quite good, so please keep them coming. The antibody tests, we really don't know how well these antibodies will neutralize for secondary infection, for example. These studies are still ongoing. We all know that the virus has only been out there and that we know of for 6 months, and a lot has been done already, but still more needs to be done to really understand how this immunity fully works. But what you can do, for example, if you do these antibody tests, is get an understanding of how the virus has spread in the community. Like, are there any particular populations or areas that are especially affected by the virus, which you can see afterwards based on the antibodies that they have in the blood. So you can do some epidemiological studies or to see how the virus behaves and spreads.
Thank you, Frank. At the beginning, you mentioned your background is actually in virology. Could you tell us a bit more about the virus itself?
Okay. Yeah, my background is in virology. I'm trained as an HIV virologist, and I'm doing a lot of work that is now becoming very handy with COVID. So COVID is caused by a virus. It's called a coronavirus. coronavirus, actually, if you put it on under a special microscope, it looks like a circle with all sort of pins protruding from it, and it looks like a crown. So in Latin, crown is corona. So that's why they're called coronaviruses. So they look quite pretty under the microscope. There are actually 6 other coronaviruses that infect humans. You may have heard, for example, of SARS, the first SARS, so to say, but also MERS, Middle East Respiratory Syndrome coronavirus that was spreading in the Middle East, and also a larger outbreak in Korea a couple of years ago. So this SARS coronavirus 2 actually has its genome, or its DNA, or what codes for the virus, is about 30,000 letters. So those 30,000 letters are sort of the recipe for the virus to make another copy of itself. So when it does that, so the virus, remember those spikes that are on the outside, they attach to a human cell. A virus is many times smaller than a human cell, and then it attaches, it fuses and enters, and then it takes over part of the mechanisms inside the cell and produces more copies of itself. The cell bursts and gets released, and then the virus is being spread again. So one of the important things that actually we need to know when we talk about SARS-CoV-2 is that when it replicates itself, when it copies itself, it has a unique feature. And the feature is called proofreading mechanism. So it's basically, when it makes a copy of itself, it checks every time if it puts in the right letter. So if it makes a mistake, it takes it out and adds a new one in there. So then it doesn't always do that correctly, but many times it's able to do so. So that's why this virus is relatively stable and doesn't change so much. For example, if you compare it to influenza or HIV, it changes half as fast.
Well, thank you. Thank you for explaining this very well. And we've heard about virus mutating. Can you tell us what does that mean? You mentioned that this virus, SARS-CoV-2, is pretty stable, but in general, what does it mean when we say virus is mutating?
Mm-hmm. I know every time I hear mutation, and my friends and colleagues talk about mutations, it all sounds very scary, and it always reaches the headlines and causes sometimes a lot of panic. So it's really important that we understand what mutations really mean. And I try to talk more about changes because I like it a bit better. It sort of describes what's happening. So when, as I said, the virus makes another copy of itself, sometimes it makes an error. And even though many of these errors are corrected, there will always be some errors remaining. Now, because the virus has millions of opportunities in the current outbreak to test whether these new changes give it any benefit. So, for example, is it able to make more copies of itself faster? Is it able to make those protruding outside spike proteins better in order to attach to cells, and so on? So it's really important that we understand the virus, how it changes, and also what differences these changes cause in quote-unquote the behavior of the virus. How does it affect our vaccine development? How does it affect our therapeutics? And how does it affect the clinical manifestation? So all these things we need to keep in mind, and we are closely monitoring that with a really large group of experts from all over the world. We are working very closely together to really understand what's going on with these viruses.
Thank you very much, Frank. This was really helpful and educational for all of us who are not deep into virology. We're receiving a lot of good questions again about testing, so I will pass some of those. So first one coming from Mohammed Khan. Do we use a specific, can we use any laboratory to do COVID-19 testing, or we need special infrastructure for that?
Yeah, this is a very good question, Mohammed, and thanks for asking it. The laboratories that are working on COVID depends on the type of test that you're doing. the regular test, like a molecular test that I just referred to see if you have an active infection, usually you need to have a pretty good setup, a professional setup to do that kind of testing. With really well-trained laboratory staff, very well equipped, and so on. That can be both in the public sector, can be in the private sector, but we really need to make sure that what they are doing gives you the right result, and the right result you can trust and actually work with.
Thank you, Frank. The next question is from Manoy Goel. How do we ensure accuracy of the results from various private labs? Is there any kind of control and audit mechanism put in place by WHO or national health authorities?
Yeah, that's interesting, and I get that question quite regularly. And these kind of quality control mechanisms generally come into play at national level. Even though many of these tests are being evaluated through mechanisms at WHO or external evaluations or national regulators, ideally we hope that people buy tests that we fully understand how they work and that their results are reliable. Unfortunately, it also happens that some of the tests that come on the market haven't been fully evaluated, and the results are not always as accurate. So as soon as we find out about that, we try to really work with the national authorities to no longer use that test. But it really depends on national authorities, local regulations, and how well they monitor the different types of tests that are on the market.
Thank you very much. Here is a next question from Detricia Coleman. How often shall people get tested, especially teachers who are being forced to go back into classrooms?
Right. That's another good question. Actually, it's a little bit beyond the scope of the type of work that I'm doing, because the work is more about what type of test, how to test, and how accurate are the results. But one thing that I can tell you, though, is that if you test for a virus negative 2 days ago, you still have that 2 days in between that you can get reinfected. So it's really a snapshot in time that tells you whether you're infected or not. So immediately after, you could get another infection. So this is quite a complex and complicated discussion. I don't think I would be the right time to go into depth right now.
We can always follow up in writing, and also you can visit our website for all the guidances that we produced during this outbreak. Here is the next question coming from Atib Ahmad. Could testing capacity be decentralized to our communities, like in case of tuberculosis, for early detection and treatment at community level?
Yeah, this is something that we are looking into, because a lot of the testing, as I mentioned, initially started at national level, and then slowly it trickled down to subnational level, and now we even try to get it to more remote settings as well, as best as possible. So there are different types of tests and equipment that you would use at those different levels. Like you can imagine, when you're at national level, you have a large laboratory, you have a large instrument or device that can test many samples. When you go to like a level below, you have a smaller kind of device that can test not as many, but still quite accurate. But when you go to like a very rural area or like a Pacific Island country, sometimes it's not always possible to get such a lab set up there. So we're looking into options and possibilities that can help countries there, possible with these new technologies that I mentioned earlier on in the session.
Thank you very much, Frank. Here's another question coming from Muhammad. What factors can affect the accuracy of the COVID-19 test results?
Oh, so many can affect the quality of a test. It ranges all the way from how the test is produced, how the test is stored, how the sample is applied to the test, how the quality of the sample. There's so many factors, and when these evaluations take place, we really scrutinize the device or the test itself to make sure that it works the way it should.
Thank you, Frank. So if the results fluctuate from positive to negative or back, why is that happening? Do we know?
Yeah. We see that not very often, but it does happen, especially when somebody has clinically recovered, and then later on after recovery, we sometimes see maybe even twice negative, and then all of a sudden there's another request for a test, molecular test, and it pops back off positive. What could be the case, and we're still looking into what's really happening, is that the virus is just lingering on, or maybe not just the virus, the entire virus, or just pieces of it, just among the limit of detection. So there's a limit of detection for each test, including the molecular test. So if you're fluctuating along that line, either it's positive or it's negative. So it is possible, and we have seen it.
Thank you, Frank. And what happens if there are no tests? What should we do then?
Yeah, that's a very unfortunate situation. When you have no tests, then you really have to rely on your clinical manifestation, your travel history. You would have to work very closely with your doctor to really find out how you can get tested, if your specimen could possibly go somewhere else. But really then you really have to take the whole big picture into consideration to explain the different diseases that you have. Like, for example, maybe there's no test for COVID, but there is a test for malaria, or there is a test of dengue, just ruling out the possibilities and understanding the context.
Thank you very much, Frank. Before we close, would you tell viewers what are we doing as WHO as well to support countries to increase their testing capacities?
Yeah. When I say WHO, actually it's WHO together with all its partners and institutions. I mean, this is really a joint effort. We are working with so many international organizations, so many experts from so many laboratories all over the world. And we are doing a lot of stuff together. For example, we're trying to really get all the reagents, all the equipment to the right places, even hard to reach places like countries with fragile health systems. They also need to test. We provide guidance, we provide training, reagents, we have discussions with experts when something new arises, like, for example, the changes that we see in the virus. How do we deal with that? We evaluate assays together. So there's lots and lots of work going on. And I'm sitting here now at the headquarters level in Switzerland, but I know that my colleagues who are in the regional offices, we have 6 regional offices, and especially the ones who are in the country, my colleagues in the country, they're doing really a lot of work also to support immediately the countries with the development and establishment of these lab testing capacities for COVID-19.
Thank you very much, Frank. And here's the very last question we received from Liard Letrom. Is it advisable to have yourself tested even if there is no manifestation of symptoms of COVID-19?
Yeah, that really depends on your situation and your context, because I don't really have the full picture of your question. It depends on where you are. Is there a lot of virus circulating in your area? What has been your exposure? Have you been to the hospital? Have you been to a long-term care facility where there is an outbreak? Is there anything that sort of triggers that testing that you need to do? So there's a bigger context than just doing the test itself.
Thank you very much, Frank. And I would say thank you everyone for watching us from South Africa, Australia, the US, India, Indonesia, Philippines, Peru, Thailand, Mexico, UK, Sri Lanka, Nepal, Japan, Vietnam, and many others. Frank, many thanks to you for responding our viewers' questions, and thank you for asking your great questions. For more information, you can always follow our social media channels or visit our website. There is the biggest source. This is the biggest source of all our work and updated information. Or tune in into our weekly pressers with our senior leadership on COVID-19. Thank you very much.
Thank you very much.